I'm Dr. Anthony Cave, and this week I had three patients come to me with three impressively bad gaslighting stories that I want to set the record straight with you so that you don't fall into these traps, because we're supposed to do no harm as doctors. You're not supposed to come to us just to have your insecurities and doubts fed and fueled to contribute to you losing trust in yourself, to contribute to more pain. And because 94% of patients in this recent 2024 study shared that they felt they were unheard by their doctor. They left the office feeling like they hadn't gotten their key questions addressed. What good is that? And I want to help you I want to help you not fall into these traps by sharing some of these real stories. Starting with this patient that I had who was going to come in for surgery, minor ankle surgery. And the first question she asks me as I'm talking about her anesthesia, she says, "Doc, how long am I going to be out for?" I'm like, "It's going to be a 30-minute surgery, and it'll be under sedation. I'm going to do a nerve block to numb the nerves around your foot so you don't even need that much heavy anesthesia." She says, "No, no, no, doctor, how long am I going to be in this brain fog for?" Maybe like 3 hours, 2 hours, maybe not even. She said, "No, but I took 3 months off of work for this." And I'm like, "Well, can you tell me what the concern was to warrant 3 months?" She apparently had a minor general surgery for a hysteroscopy. Maybe you in the audience have had one of these before. Let me know in the comments below, now that you can hear me. And this type of minor surgery, most folks are back at it maybe the next day or in 1 or 2 days, depending on how much has to be done in the pelvic region. Maybe it's a polyp removal. Maybe it's just evaluating for some other source of pain. But regardless, 3 months of brain fog from a relatively minor general anesthetic and minor surgery is not normal. This young lady, like Brittany's saying, 3 months for 30 minutes is not normal. She was told by her surgical team that that's a normal response, nothing to be worried about. Well, don't. What happened in the 3 months after her hysteroscopy? She was so brain fogged and cognitively, if you will, dysfunctional that she developed clinical depression. So this is not a normal response after a minor surgery. While postoperative depression can be a real thing, this is not something that should warrant some degree of long-term mental health and physical health complications, because she also wasn't able to exercise and actually gained a lot of weight and had an A1C that became elevated for the first time in her life. So telling someone that it's normal to be up for 3 months without maybe looking at what other medical conditions they might have or genetics that might be contributing to this, just to share a couple of potential contributors, is not appropriate. More about this in a second. Let's go on to patient number 2 that I had. This one blew my mind. This was a woman in her 50s of South Asian descent, meaning like Indian. And she had a mother with a heart attack at age 62. Already, my radar is going up. I'm like, this is not normal. And then on top of that, I'm reviewing her blood tests, and she has an abnormal lipoprotein little a. This is a special type of cholesterol carrying particle that is bad news. It's really genetic. Most people actually don't have this floating around. So Indians, because they have a higher risk of heart disease, have this in higher quantities. It's a very dangerous molecule to have, especially if other risk factors aren't being taken care of. So I shared with her, "Hey, what are you doing about this? What follow-up tests were done?" She's like, "Nothing. I was told that it's fine. There's nothing to worry about." I don't want to say my jaw hit the floor, but it got kind of close. I'm curious if anyone here has ever had an abnormal blood test, even though it says abnormal, show up in their report and they're told it's just normal. I'm really curious. L. Phillips, good to see you. If you have had an overt blood test in red, not be addressed, you're just told it's normal, please ask your doctor about simple question, what could this mean, and what's the worst thing that could happen from this if we don't do anything? It's not fine, because if someone has a family history of a female under 65 with a heart attack, And if you recall, the mother of this patient was 62 at her first heart attack. And they're at risk genetically, like from South Indian descent or Indian descent. And you have an abnormal blood test that's genetically linked, like lipoprotein little a, LP little a. It is not fine, and you need to do something about it. I immediately got on to get some more labs ordered because that would effectively, not doing anything, is potentially signing someone up for an early heart attack. Is so inappropriate. And then this last case here. This is something that actually I have done to patients that I recently learned just how damaging it can be. I didn't do it maliciously, I promise you. And I did a whole video on this, which I encourage you to watch. I'll link it in the description below. It has to do with the mask that goes on just before you fall asleep. And I'm curious if any of you have ever had surgery before and remember the mask going on before you fall asleep. I wonder if anyone, let me know in the comments if anyone here has had that happen, because something, oh, well, interesting. Sorry to change the subject. Bobby Blair Thompson. I had an elevated LP little a. My doctor said it was no big deal. Well, I'm curious here. Perhaps something to ask, and I think the wording is very non-confrontational. What could this mean, and what's the worst thing that could happen if we don't address it? So many folks are telling me that they remember the mask coming on. And what Sterling Hawk makes me think that I am being smothered. So I always appreciated this could be uncomfortable, perhaps, and be claustrophobic. What I did not understand is that a certain number of patients tell me they can't breathe when it's on their mouth, over their face. I would look at the monitor and it shows normal oxygen. I see the ventilator demonstrates they're moving oxygen as well. So I would say, hey, it might feel uncomfortable, but you're moving air. You're getting good oxygen. It wasn't until I experienced something similar, and this is when I did a whole video on exactly what my experience was. It was while scubaing with this mask on, and I felt like I couldn't breathe. The first time in my life I ever experienced this type of anxiety from having something on my face, or an inability to breathe room air the way that I am right now, the way that you all presumably, hopefully are. And it was the most anxiety-inducing experience of my life. I couldn't just take it off, and I'm 100 feet underwater, obviously. And I realized that sometimes a patient, I can tell them that they're just fine, but from my experience, it's not fine. And I don't want someone to fall asleep with that feeling of like impending doom or anxiety, like I can't breathe with this thing on. Even though, like in my case, I knew I was breathing underwater. I could see my oxygen just tanking in the tank, no pun intended, as I was breathing so fast because I felt like I couldn't catch my breath. These have real consequences. Why does it matter? What gaslighting does to patients is that, as you can tell, can, first off, delay diagnosis and treatment. In that case of heart disease, these can be life-limiting consequences for folks. Number two, you can cause more disease. Consider the first patient who 3 months of post-operative just brain fog, forget not being able to work or social interactions, but this depression that developed, the weight gain, to the point where they're so nervous for the next surgery, even though it's a minor ankle surgery, expecting another 3 months of brain fog because no one bothered to tell them that's not a normal response. And let's do something about it. There are real life consequences to worsening existing disease. And perhaps the most significant, the hardest to quantify, and I'm very curious what you think, is the erosion of self-confidence that comes with this. I'm not too sure how else to express this other than if we want to do something in life, but we don't feel like we can, if they're not in alignment, if there's a divergence between them, that angle represents pain and suffering. It's fear, uncertainty, and doubt that puts these two arrows farther and farther apart. And that is where pain comes from. Gaslighting is a surefire way of diverging those two arrows as fast as possible. I'm really curious. I want to go through your comments and answer your questions. And if you have felt this way before, you're not alone. But I hope that you learn something new about a way to advocate for yourself so that you minimize the risk of this happening to you or to a loved one. If you learned something new, please hit that like button and subscribe to keep up with all my lives. And for the members out there, I can see your comments more easily, and I appreciate your support. So I can do this without having to bring on other advertisements, because I feel like it gives you the most objective experience. I want to start with this. After I was rear-ended, a doctor treated me like I had no damage. Simple x-ray revealed massive spine and neck damage, but I got screwed over because some doctors know better than to take a look. Well, this goes to the question of labs again. Maybe something is abnormal. You, unfortunately, in the way the system works, need to feel confident advocating for yourself. That erosion of self-confidence, needless to say, can be incredibly damaging. And I would not want any of you to have a report, not understand what it means, and not do anything about it. Is this why all the ketamine is often used as part of the anesthesia cocktail when appropriate? Elliot, I'm not quite following what ketamine has to do with the erosion of self-confidence of gaslighting, but please be sure to let me know maybe more specifically what you mean. I did advocate for myself. Now I just don't go to the doctor anymore. Well, trust in doctors and medical institutions has definitely nosedived, especially during COVID and after COVID. While I hope that BV Luminous, you do feel comfortable going to the doctor again if you need to, I hope that you get the care that you deserve if you do go to the doctor again, so that you don't walk away feeling like you were unheard and unaddressed. Brittany, I wish ketamine was my anesthesia regimen. It's always Versed and propofol. It's a conversation you can have with your anesthesiologist. You have so many comments on your channel that I feel like mine is passed on without being noticed. Carol, well, I'm sorry that you feel that way. I'm certainly not doing it intentionally. Dana, who had the best comment earlier about feeling gaslit when my mic was on mute, had a complete physical and labs a week. To the day of a heart attack, had some high levels, expressed concern, and was told to change my diet. Well, diet can help some things, but not all things. That lipoprotein little a is not really responsive much to diet, though perhaps to inflammation, which might be related to mental health. A couple of degrees that you need to jump there, but you need to make sure that if there's something abnormal, you feel comfortable pinging your doctor about it right away. I'm really sorry that you had a heart attack so shortly after those labs. Compassion, kindness, and empathy are free. Why do so many in the medical profession not share it? Gosh, we should start that comment as well. Third pulmonary embolism found at a weekend ER visit, sent home and told to call my doctor on Monday. Well, 07 Enigma. I wasn't there. I can't comment specifically on the decision there. If they're very small, there might not be anything to do. If they're large, obviously, there would be something to potentially do. But I'm sorry that you had those PEs. I hope that you're feeling better now. And L. Phillips, thank you so much for that kind super thanks. It's very nice of you. Tally Matthews, you're very, very welcome. And, Anemone Cat. Anesthesiologists specialize in physical pain and its toll on the quality of life. I believe they also have knowledge to help with mental pain. They should use their knowledge. The world would be, there are many psychologists and psychiatrists out there who do a wonderful job. I think that anesthesiologists have a privileged view of your self-conscious in a way that no one else does. So I hope more anesthesiologists can internalize the message that you just shared. It's so powerful. Robin, thank you for being a member of the channel. I had the anesthesiologist went to put on the mask. I said I wasn't ready. He said they were ready, so we were starting. He pushed the mask down on my face. Well, Robin, I'm sorry that you had that. It's, there is something about having this on your face because it's like losing control. And then if you also feel like you're not ready and it's being forced on, well, there are some emergency situations where we need to get moving because someone might be actively bleeding out and dying. They're unfortunate situations. They're rather rare, but sometimes we do need to do something almost, even if the patient isn't 100% comfortable yet. I suspect that was not the situation you're referring to, Robin, so I'm sorry that you had that experience. And I hope that if you ever need surgery again, that you feel comfortable speaking up for yourself. Is the ER packed this weekend? I don't know. I hope not. Here in San Francisco, unclear. Going to a new pain doctor now, says Jody. The doctor is an anesthesiologist. I hope he has a kind heart. Well, thank you for the kind comments, and I hope that you do get pain relief with this new doctor. They keep telling me it's normal. Molly Ollie, your great name, by the way. Some things are normal, some things are not. You as a patient can't be expected to know these, but if you have an intuition or a nagging feeling, you have to feel comfortable speaking up for yourself to help distinguish between the two. Nuts and bolts, the U.S. military trial pharmacogenetic tests found it cost-effective. Less emergency admissions due to serious drug reactions. Why are they so unpopular? Because genetics for preventative treatments are just not an insurance coverable service. All the genetics work I do with my patients is not covered by insurance. It's kind of expensive if you want to have high quality reproducible tests. But unfortunately, there are many direct-to-consumer genetic tests out there. A lot of them kind of suck. So I use a particular one that's not direct-to-consumer for my patients. It is a little bit expensive, but the good news with genetic tests is that it's a once-in-a-lifetime test, and I'd much rather you have data to base recommendations off of instead of just kind of shooting in the dark and hoping something sticks. And certainly you don't want to be walking around with a suitcase of supplements or medications that you have to keep trying just to not get a response. Mary Ann Sadar had a spinal surgery on Wednesday, another zero complication procedure. It is always the same team, which is really helpful. I'm so happy to hear that, Mary Ann. Had Gabby, now I remember, had wisdom teeth surgery a few days ago, so going to jump off. Well, I'm wishing you the best in your recovery, Gabby. Terrible experience with ketamine, says Robin. I've heard people pulled out IVs. They didn't re-gum. Please tell your anesthesiologists so that maybe they use something different than ketamine, maybe dexmedetomidine. Though there are some studies that show that postoperative delirium after cardiac surgery are actually improved outcomes with regards to delirium using ketamine. Hi, Kaylee, right back to you. You are so welcome, Gabby. Ginger, I woke up during surgery before. They told me that it was not possible. When I told them what they were talking about during surgery, they looked at each other and got quiet. I hear this story a lot, and I'm not too sure why someone would try to discount that experience that someone shares, rather than with curiosity ask and acknowledge so that we can learn what led to it so it doesn't happen again. I hope I'm not asking too much. Robin, I'm happy you put it on your allergy list. BV Luminous, what is it when I wake up in the middle of the night and lower jaw is so tight that I have to pry my mouth open? Well, I'm not quite sure what to say about that, but I certainly hope you discuss that with your doctor and that there's not erosion of your teeth, maybe from bruxism from that very tight jaw muscle. We'll end with Girusahai's comment. I recently had lumbar fusion surgery. The anesthesiologist is fabulous. I feel like your videos helped me to have a much better and more proactive conversation. I'm so thrilled that you felt safe and cared for because how you fall asleep in part influences how you wake up. And I believe, based off the available data and literature out there, that actually has a bearing on your long-term recovery as well after surgery. Because your psychological body and your physical body are so tightly linked, you can't expect one to be healthy if the other one is not. Eventually one will catch up with the other. I hope everyone learned something new. Remember that you have more power over your health than you've ever been told. And if you did learn something new, share with your loved ones and hit that like button to keep up with all of these lives. I hope to see you on the next one. Till next time.